My father once told me, "It's good that I can feel people's pain. It would be even better if I could transform one's pain into soothing relief." These words of my father nourished and nurtured the divinely planted seed in me to become a compassionate healer. And my journey with Ayurveda, the science of life, began. According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water, and earth. And solution to all chronic ailments lies in balancing these body elements. As the origin of Ayurveda goes back to thousands of years, so some part of our ancient historical knowledge is lost. That's why I started my own research and shared it with the world. Ayurveda can give very quick recovery, even quicker than allopathy, in most chronic ailments.
The blend of Ayurvedic medicines, Panchkarma, yoga, diet has helped Dr. Nadeep Sharma create the brand Risht Pusht and Team Nirogam by treating thousands of patients suffering from chronic illness. Join Dr. Nadeep Sharma's guided path of healthy living. Call now at +1 888 624 5925.
A very good evening to all of you in this evening live interactive session of ours where we generally try to discuss quality Ayurveda with you. हमारे आज के इस लाइव इंटरैक्टिव सेशन में मैं डॉक्टर नवदीप शर्मा आप सबका स्वागत करता हूं और जैसा कि हम प्रयास करते हैं एक टॉपिक के साथ साथ आपके क्वेश्चंस लेना हमारी हमेशा प्रायोरिटी रहती है. Our today's topic will be ADD and ADHD. But then my priority will be your questions. I will definitely be replying to your question. And while I am replying to your question, if time allows me, I'll be taking in details about ADD and ADHD. So first of all, let us start with your question. Raksha ji, namaskar, hello. And then there is a question about Anil ji. ITP में पंचकर्मा ले सकते हैं. Anil ji देखिए देखना पड़ेगा platelet count कितना है. पंचकर्मा can also be risky in ITP if the platelet count is too low. हाँ हम पूर्व कर्मा ले सकते हैं. सो प्लीज प्लेटलेट काउंट का जरूर ध्यान रखिएगा. सो नाउ कमिंग टू द सेट, प्लीज टेल अबाउट व्हाइट मैटर हाइपर इंटेंसिटी इन चाइल्ड एंड इट्स स्कोप ऑफ ट्रीटमेंट. सो again coming to the white matter hyper intensity, see what happens is when we go for MRI scans, the MRI scans, if a particular point or particular area is hyper intense, that means that the white matter, the neurons of the white matter, maybe due to delayed crying or due to some other reason, they are not that much in density as much as is required. So that is definitely a matter of concern in some cases. However, in some cases that may not give any symptom. So whenever we are having a white matter hyperintensity, the signs and symptoms also really matter a lot. A lot depends upon what the signs and symptoms. Is the child having any kind of seizure due to that, or if the child is having any autistic signs due to that, if there is any delay in speech or delay in learning, there can be some signs of it. There may not be any signs of it. In many cases, it may go even unnoticed. So what I would request you is the reports, if you can share the reports on the number, so we can also figure out what level of hyperintensity is there over there. So Anil ji, if it is 35,000, then मैं suggest करूंगा कि थोड़ा सा आप प्रधान कर्मस को avoid कीजिए. 35,000 बहुत कम platelet count है. कोशिश कीजिए you can go for पूर्व कर्मस and that also mild पूर्व कर्मस. Not आप अगर भारी हाथ की मालिश करवाएंगे तो इंटरनल ब्लीडिंग हो सकती है. सो अवॉइड इट. पहले थोड़ा सा आयुर्वेद भी कहता है कि अगर कोई व्यक्ति थोड़ा बल में कम है, कम बलवान है, तो पंचकर्मा को अवॉइड करना चाहिए. सो थोड़ा सा अवॉइड कीजिए. Tom Gautam ji, you have mentioned your patient code and you have mentioned the age of your child, which is 5.3. So I'll be waiting as soon as I get some further details in your child's regards, either from your coordinator or from your end. I'll be guiding you in this regards. So we are talking about attention deficit hyperactivity disorder, ADHD, or attention deficit disease. Now there's a very brief kind of distinction between the two, and there are some doctors, some psychologists who will say ADHD and ADD to be the same disease. There are others who will say they have a brief distinction, and the brief distinction being that attention deficit hyperactivity disorder child will be more impulsive and will be less cooperative with children of his age group, will maybe having a bit of problem in mingling with the other children of his age group, whereas a child who is only ADD might be more friendly than a ADHD child with the peers of his age group. But again, in both those diseases, the major problem which lies in the fact that the concentration span of the child is too low. Now, when we are doing any kind of work, the concentration span always is required to be on a particular, you can say, span. If I am speaking on this live, or if we are reading something, if we are doing anything, we need to concentrate to do any work. And when we concentrate, the subconscious mind is there on a particular topic for a particular time span. The conscious mind perceives a particular thing, provides a signal to the subconscious mind, and the subconscious mind will focus on that particular task, and then we will be able to do the task to a greater degree of perfection. However, if that concentration span is too low, then from one task to other, from another task to somewhere other, the focus will be pretty less in all such cases. So over there, the concentration span will be very less as compared to what is required over there. So what needs to be done in such cases? The concentration span needs to be worked on for any child like this. Because when we talk about ADD, ADHD, there is nothing much that can be had from the allopathic perspective in such diseases. Nothing much. Some of them, the children may be given risperidone, ariprazole kind of things, or you can say working on the conscious mind, which sedate the conscious mind a bit, making the child a bit less hyperactive. Whereas in many other children, if the child is too slow with a lot of learning disabilities, the child may be given a bit of antidepressants also if the child is at a higher age. So a particular kind of treatment, if we say no, nothing is available over there. So hope lies in Ayurveda for such diseases. There are multiple herbs, multiple, not just single herb. Depending upon the body type of the child, there are multiple herbs which work on the concentration span of the child and which can really help to improve that concentration span. जुगल किशोर जी, नमस्कार। आप अपना सवाल पूछ सकते हैं साथ साथ में, और आपने लिखा है कि माय चिल्ड्रन आर हैविंग स्पीच प्रॉब्लम्स। आई वुड बी गोइंग थ्रू योर क्वेश्चन बिफोर आई प्रोसीड फर्दर। दीप शिखा धीरज जी, आपने पूछा है एडीएचडी में बच्चा बात करने में प्रॉब्लम होता है क्या? हो सकता है, डेफिनेटली हो सकता है। अगर एक बच्चा एडीएचडी चाइल्ड है, सो डेफिनेटली उसको बात करने में प्रॉब्लम हो सकती है, क्योंकि वो उतना कंसंट्रेट, उतना फोकस ही नहीं करेगा कि वो नोट करे अपने पेरेंट्स को। कई बार रीइंफोर्समेंट के साथ उसको ये आदत डेवलप कर सकती है कि वो शब्दों की जगह इशारों से बात करे। सो डेफिनेटली स्पीच में प्रॉब्लम आ जाती है एडीएचडी वाले बच्चों में, क्योंकि स्पीच एक ऐसी चीज है जो डेवलप करती है थ्रू रिफ्लेक्सेस। रिफ्लेक्सेस के साथ क्योंकि स्पीच डेवलप करती है, एज अ रिफ्लेक्स लर्न करते हैं हम लोग स्पीच को, सो प्रॉब्लम आ जाती है। सो वी आर हैविंग टॉम गौतम जी, whose details are shared with me through Rajat. You are from Nepal, sir, and Nirvan is 3.5 years. He is diagnosed and already diagnosed, in therapies in special school you are going for. Speech therapy is there, eye contact is there, which is not very good. And when we talk about the speech, it is two words. He has a bit of communication, he sings rhymes, name response is moderate, he does not follow instruction with gestures. He tells his demands, he is hyperactive, he runs here and there, he screams, he laughs alone. Hyperactivity, socialization problem is there. And when we say about a child like Nirvan, now the good thing is that he does use some words. In many cases, we come across children at an age of 3.5 who won't be using any words if they are not focusing, if they are autistic, or if they are ADHD children. But for a child who's already using some words, the things become easier. Because if a child can use some words, we definitely can work on the child and ensure that the child is using more words. And for that to happen, it becomes very important that no, you were telling that my child preterm baby and now is 5.3 years. Again, we are talking about you, Mr. Tom Gautam. So he is now 5.3 years in age. Please uh, mention me that is he using some words or is he not able to use any words? Because from your coordinator's end, it has been mentioned that he can use some words. So is he using some words or not using any kind of words? And if he is using words now or not using any words now, was it a regression that occurred in his case? Was he using some words at some stage which he is not using now? So हम आगे चलते हैं और we are having Shrikant Godji with us, and you have mentioned that my son is autistic kid. Once he react very good, but once he is very differently. Shrikant Godji, when we are talking about autistic kids, see, it is the subconscious rigidity which causes autism in a child. And when we talk about subconscious rigidity, it means that subconscious mind, despite having the knowledge in it, despite having the capability of replying, prefers not to reply on the commands of the conscious mind. So as a result of that, at some junctures, you will feel that the child is pretty intelligent, while at other junctures, you will feel he's not at all. So that is where the problem majorly lies in. At some times, he is good enough. On the other times, he's not replying to that good enough. So what we need to do over there is we need to work on the rigidity of the subconscious mind so that now the child becomes more responsive. He regularly starts replying on the commands of the parents, on those around him more frequently. For that to happen, the subconscious rigidity needs to be brought down. That is what we generally do. So Tom Gautamji, as you mentioned, he is using very few words. Again, if you check over there, you will see that he has those words with him. He's preferring not to use those words. I generally guide parents when I'm speaking to them that, see, if I ask you, please sing a song for me, and you reply me back, no, I won't be singing it. Now, there can be two reasons to that. One of the reason can be that you don't know how to sing a song. And the other reason can be you don't know how to sing a song. So one is you don't know how to sing a song. Other is you don't want to sing a song. Both reasons can lead to you not being able to sing a song. So same comes true for the child. A child may be having the capability to use the words and still is not using those words, while there can be another case where the child is incapable of using the words. In children, Mr. Tom Gautam, who are able to use some words but not complete words, it means that they are having the capability to use those words, but still they are not preferring to use those words. So we need to work on the subconscious rigidity, and once we work on that, that means that gradually that rigidity will come down and the child will be able to use those words. So please share some further details, and I'll be guiding your coordinator once I get some videos from your end for the child on what exactly we need to go ahead in your child's case. अनिल जी, आपने मेंशन किया है कि आईटीपी पित्त दोष में विरेचन 1 साल तक दवा लिया हूँ, डॉक्टर विक्रम चौहान एमडी आयुर्वेदिक पंजाब मोहाली, बट नो रिस्पॉन्स। आगे क्या करना चाहिए? हम सोच रहे हैं कि विरेचन कराने के लिए। अनिल जी देखिए, डॉक्टर चौहान एक बढ़िया डॉक्टर हैं और प्रॉपर डिग्री होल्डर डॉक्टर हैं। सो अगर आपने 1 साल तक वहाँ दवा करवाई है और आगे, हाँ, ये डेफिनेटली मायने रखता है कि जब भी आप किसी के पास भी जाते हैं, आप मेरे पास आए या डॉक्टर चौहान के पास जाएं, जो एडल्ट पेशेंट हैं, बड़े वाले पेशेंट्स हैं, उनको कोशिश करनी चाहिए कि ऑनलाइन ट्रीटमेंट की जगह पे अपना नब्ज दिखा करके इलाज करवाएं। आपका जब पल्स डायग्नोसिस किया जाएगा तो पल्स डायग्नोसिस प्रॉपर बता पाएगा कि पंचकर्मा के आप योग्य हैं कि नहीं हैं। केवल मात्र ऐसे ही अंदाजे से प्लीज आप विरेचन मत कराइएगा, उससे वायु और बढ़ जाएगा, आपके केस में वीकनेस आ सकती है, चैलेंज आ सकते हैं। सो प्लीज आप ध्यान रखिए, पंचकर्मा बहुत सोच के बड़े ध्यान से करवाना है, ऐसे ही अंदाजे से नहीं करवाना है। बाकी आईटीपी आयुर्वेद में रक्त पित्त कहा जाता है इसको, और अच्छे रिजल्ट्स आते हैं आयुर्वेदिक ट्रीटमेंट से। अब लेकिन हर आईटीपी पेशेंट की दवा अलग है, सभी की सेम नहीं हो सकती, प्लीज इस बात का ध्यान रखिए। एंड ये एक मेरे को मैसेज आया यहाँ पे वरुण बांसल जी का कि सर मेडिसिन से बच्चा वॉमिट कर रहा है। वरुण जी प्लीज पेशेंट कोड जरूर लिख कर भेजिए, हमारे लिए बड़ा जरूरी है, क्योंकि हम डील ही सारे बच्चों के साथ कर रहे हैं, तो कोशिश यही होती है कि मेडिसिन टेस्टी बहुत हो। तो हमारी मेडिकेशंस बहुत टेस्टी होती हैं। अगर ऐसा कभी चैलेंज आता नहीं है, अगर आया है ऐसा कोई चैलेंज, प्लीज एक बार कोड लिख भेजिए ताकि चेक किया जा सके कि, और ये भी थोड़ा बताएं आप किस डॉक्टर को मिलकर के दवा लेकर के गए थे, कहाँ से आए थे, थोड़ा सा डिटेल शेयर कर दीजिए, और पेशेंट कोड जरूर मेंशन कीजिए, वो बहुत जरूरी है। रिया जी आपने लिखा है सर जय को कॉन्स्टिपेशन प्रॉब्लम है, उसके लिए बताइए। रिया जी पेशेंट कोड आपने बताया है, अगर ऑटिज्म के साथ साथ कॉन्स्टिपेशन है तो बबूना ड्रॉप्स बेस्ट है। जो आप बाकी दवाइयाँ दे रहे हैं उसके साथ साथ आप बबूना ड्रॉप्स का इस्तेमाल ज़रूर कीजिए। यहाँ एक छोटा सा ब्रेक मैं लूँगा, क्योंकि मुझे थोड़ा सा सेग्रीगेट करवाना है क्वेश्चंस को। आई डोंट वांट क्वेश्चंस टू बी मिस्ड, और मैं देख पा रहा हूँ कुछ क्वेश्चंस मिस हो रहे हैं बीच में से। छोटा सा ब्रेक, प्लीज स्टे ट्यून्ड विद अस व्हाइल आई एम segregating the questions so that I can take your questions. So stay tuned. We will be back with a 2-minute break with you.
I went through the Panchkarma therapy here, which has Shirodhara and Nasya in it, and it is really recommended, very relaxing, and everybody and whosoever needs it must go through it.
हम लोग अपने बेटे के लिए आए हुए हैं यहाँ पे आयुष्मान मंडल, इसका उम्र लगभग 14 साल है। यहाँ हम लोग पंचकर्मा थेरेपी लिए। यहाँ का माहौल इतना फ्रेंडली, डॉक्टर स्टाफ सारे कुछ बहुत अच्छे लगे।
पहले ये ना बोलती थी ना कुछ समझती थी, लेकिन जब से ट्रीटमेंट ले रहे हैं काफ़ी हद तक इसमें इम्प्रूवमेंट आई है।
I came in contact with Dr. Navdeep Sharma regarding my son Shritik. So he is 3-year-old and he is having speech delay and he is having some ADHD behavior. It was a good experience. But one thing I can say for sure that my son's sleep routine is pretty much better than before.
We came to this center, had an appointment with the doctor. We had a great session with him. He has immense knowledge about autism. He is specialized in autism and ayurvedic treatments. The therapies were done very well, and the housekeeping and everything was clean. The rooms are clean, so we had a good stay, good interaction with the doctors and therapists. So overall it was a good experience.
उसका पंचकर्मा हुआ तभी उसमें जो हाइपर एक्टिविटी था उसमें हमें बहुत फ़र्क नज़र आया और उसकी
So we are back live with you, and thanks for being there with us. The question which I missed was from जुगल किशोर जी। जुगल किशोर जी आपने लिखा है माय चिल्ड्रन प्रॉब्लम स्पीच की प्रॉब्लम का इम्प्रूव हो सकता है। जुगल जी थोड़ा सा एज बताइए मुझे, और कुछ वीडियो शेयर कीजिए जो हेल्पलाइन नंबर आप स्क्रीन पर देख रहे हैं उसके ऊपर। और डेफिनेटली देखिए स्पीच प्रॉब्लम में बहुत बढ़िया इंप्रूवमेंट आ सकता है। एक पर्टिकुलर एज तक तो पूरी तरह से रिवर्स हो सकता है, प्रॉब्लम पूरा ठीक हो सकता है बच्चा। एक पर्टिकुलर एज के बाद कुछ हद तक ठीक हो सकता है। एज बहुत इंपॉर्टेंट है स्पीच प्रॉब्लम में। सो प्लीज आप मेरे साथ एज भी शेयर कीजिए, कुछ फर्दर डिटेल्स शेयर कीजिए ताकि आपको पूरा बता पाऊं। एंड आई एम वेटिंग फॉर द रिप्लाई टू माय क्वेश्चंस मिस्टर गौतम जी, टॉम गौतम फादर जी। सो प्लीज शेयर द थिंग्स। एंड श्रीकांत जी आई टुक योर क्वेश्चन, एंड देन वरुण जी को भी मैंने जवाब दे दिया। रिया जी आप लिखा है कॉन्स्टिपेशन का, तो आपको बताया। यस रिया जी, वो आप नॉर्मल दवाइयों के साथ भी मिलवा सकते हैं और अलग से भी ले सकते हैं, क्योंकि जो आपकी नॉर्मल दवाइयां हैं हर ऑटिस्टिक बच्चे को, क्योंकि कॉन्स्टिपेशन नहीं होती है इस कारण से हमने हर बच्चे के साथ नहीं ऐड किया होता है उसे। तो बबूना ड्रॉप्स जहां बच्चे को साथ में कॉन्स्टिपेशन या थोड़ी बाउल की प्रॉब्लम रह रही है वहां पे हम लोग बबूना ड्रॉप को प्रेफर करते हैं। ट्रेंडी वीडियोस से आपका क्वेश्चन आया है। माय सन अंश Shidra, 7 years old, going special school, but he's learning some other activities that he should not learn. You are very right in that. See, I always guide the parents that if the problems are not too much in the child, try putting the child in a regular school. When a child goes to a special school, and the child is not having that much problems like other children over there. If a child is severely autistic, we know we are left with no choice but to put the child in a special school. But if our child is not that problematic, we should avoid sending the child to a special school. You can instead have a psychotherapist coming to your place for doing the necessary things, or we can be training you for the psychotherapy part. You can take trainings from our team, or you can join our live sessions. We are having multiple sessions where we guide the parents. So you can start one of those things, but yes, definitely, if he goes to special school, he will learn those things which we don't want him to learn. वरुण जी प्लीज रिक्वेस्ट है पेशेंट कोड हमारे यहाँ पे, क्योंकि हर रोज के हजारों ऑटिस्टिक बच्चों का ट्रीटमेंट स्टार्ट होता है डेली, थाउजेंड्स ऑफ चिल्ड्रन अराउंड द ग्लोब they come to us, so it becomes very important, like you must have seen in all the questions which have been shared away over here. So a particular patient code has been mentioned by all of them. When you share the patient code, immediately we enter that patient code in our softwares, and entire history of the patient comes in front of us. So that patient code is very important with us. If you cannot share the patient code, share your registered mobile number with us. Even that can be used for taking out your reports, the details, but we do require that thing. उसके बिना थोड़ा सा बताना मुश्किल हो जाएगा हमें. डॉक्टर रूपाली जी आपने लिखा है प्लीज टेल द ट्रीटमेंट फॉर एडल्ट एडीडी 45 years male with normal IQ. Rupali ji, if we are talking about an adult with ADD with around 45 years of age, we need certain pacifying herbs over there. Those kind of pacifying herbs which are at the same time good for the mind, good for the coordination of conscious subconscious, like petha is one of them. Petha is very good herb, lavender is very good herb, and then again jatamansi is very good herb. In such adults we use brenoir capsules. We are having it in the form of capsules for adults, where we use rudraksh again is one of those things. So such kind of things are generally utilized over there. So I would further appreciate if you can get some further insights in the patient's details. You can share the same on the number which is there on the screen. But Breno-R is something which is pretty safe to be used in all such cases. That can be used. And going ahead, रिया जी आपने कहा सर जय बहुत खो रही है अपने में, उसके लिए क्या करूं? अगर आपको रिया जी लग रहा है कि अपने में ये बहुत ज़्यादा खो रही हैं, तो मैंने जैसा कि पेरेंट्स को बताया होता है, थोड़ा सा स्पिरिचुअलिटी फैक्टर भी हमने इस्तेमाल करना है. मॉर्निंग एंड इवनिंग जहाँ पर भी आपका फेथ है, हमारे इलाज के साथ साथ आप थोड़ा कोशिश कीजिए कि उस पर्टिकुलर फेथ के अकॉर्डिंग, जो भी आपका फेथ है, आप ज़रूर क्या कहते हैं, थोड़ा सा आरती या थोड़ा सा कोई रिलीजियस मंत्र, जितना भी आपका विश्वास है डिपेंडिंग, वो जरूर इस्तेमाल कीजिए. उससे बच्चा अपने आप में थोड़ा सा खोना कम करेगा. बाकी मेरे पास डिटेल्स भी आप शेयर कीजिए, जो नंबर आपकी स्क्रीन पर आ रहा है इसके ऊपर अगर आप डिटेल्स शेयर कर देते हैं साथ के साथ सारी अपने पेशेंट के, तो आई विल डेफिनेटली बी गाइडिंग यू. सो अगेन वी आर कमिंग अहेड विद द नेक्स्ट क्वेश्चन which is there from 462132, and when we are going with 462132, Alisha ji हैं हमारे साथ, and mother of Alisha ji has joined with us, and again 6 years old, and he is not concentrating, a little bit always speaking and repeating same thing like truck, line, etc., and he is not having proper sense of potty and urine. That means he is not potty and toilet trained, and at the same time sometimes he reacts immediately in a spike. So basically what happens over here, Amolji, is that so I mixed up the two things. Sincere apologies. I'll again be coming back to the question of Alisha ji. The number of questions being more, sincere apologies, Alisha ji. I was starting with yours, and then the next one came to me, and I mixed both those up. Sincere apologies from that. Alisha ji, you have mentioned that he was diagnosed with autism, and then you started giving OT therapy, but nothing worked. And what I would like to tell you is, see, OT, occupational therapy, is not very ideal and a very preferred kind of a therapy for autistic child. OT is good for a severely autistic child, but OT will generally make a child robotic or hyperactive if the child is mildly autistic child. OT should be used only for once a week or at the max twice a week. What we are doing nowadays is we send our children to special schools, we send our children to therapy centers, and OT is the easiest one to do, and excessive OT is being done for the child. For example, if someone keeps on commanding you throughout the day, asking you, expecting you to be doing a lot many things on his commands throughout the day, at a particular time you may become resistant to those things. So the therapy of choice is ABA, and that also ABA which is being done by the parents themselves for the child, not by anyone else, the parents. So it is the ABA, the applied behavior application, which we train to the parents, and then the parents, they in fact communicate and train that to the child. That is what needs to be done over there. So my sincere request to you is that share some further details, and do remember it is ABA through you. The good thing uh, which is very much evident over here is that, see, you have the awareness of the situation, you are doing something, because at times the parents won't be doing anything. So that is pretty wrong. I would further like some details in this case. I am not having the age of Alicia. I am not having any further details. So share some further details. The coordinator hasn't shared me the complete details, so I am unable to guide something on what we need to be doing for the child. But yes, I tried answering what with the minute details which I had. So if you can share some videos also of the child, that will be pretty appreciable, and then I can help you in a better way. Amolji, I took your question first of all. I mixed it up with Alicia. So now coming to your son, since he's using certain words like truck, loin, now that is a good thing. It means that yes, he has some words with him. If he's having those words, we can make those words to words in context and in need, like Papa biscuit, Papa apple, Mama biscuit, Mama apple. So that is something which needs to be done over here. So ABA, and along with ABA, since the age is such where we need the spikes to come down, the spikes in behaviors show somewhere that somewhere it is the conscious which is working to a greater extent as compared to the subconscious. So we need to be working on the subconscious with Breno R over here. Breno R would be the ideal thing for him, but still, to be on safer side, I always guide the parents. Please, whenever it's possible for you, it's always preferable meeting. If not possible, sharing some videos, getting yourself analyzed from our psychotherapists, and then if we do the right things, like I got the details in Alisha that she's 5 years in age. Now, 5 years of age is a trainable age. Definitely, after 4 years of age, we have lost the reflex learning age. The language development is best till 4 years. Automatically, it comes. If someone comes to us below 4 years, the work, the quickness of the outcome of treatment is really miraculous. But from 4 years to 12 years, still it is a trainable age. And if we do something at that age also, the child can completely come out of it. But those right steps need to be taken at the right time. The key to success in autistic child is not wasting the time. It's easier for a parent to leave the child in a special school, go for OT therapy, go for speech therapy. You will be saved from the hard work and efforts which you need to put on the child. But the child will not be able to come out of autism with that. It's your love, your efforts, your hard work in the form of self-done ABA for your child, along with the usage of bit of Ayurvedic herbs, which can work miracles for your child. Please give your child ample time. Once you give that time to your child is going to come out of it. Again, I am having a question from Saif ji. Hi, sir. We have started your medicine for my 3.3 years autistic son since 20 days. Also, we have started ABA session. My query is my son's hyperactivity is getting increased. Yes, Sahil ji. If you are giving any kind of supplement to the child, but you are not getting the needful work done for the child, please share. When I say needful work done for the child, see, first of all, what you should remember is that at least for next 1.5 months, the herbs are not going to do anything for the child. Herbs are generally slower to act as compared to any kind of, you can say, allopathic medications. But once, since you have started ABA, now once we start using ABA in a child, earlier what was happening was, you were listening to your child, you were showing your child that you are understanding all his sign languages, everything you are understanding. Life was easier for your child. You were not resisting his needs. So there was less chance for him showing any tantrums, any hyperactivity episodes to you. But now, since we are doing ABA, in the beginning part, when a child earlier was at a stage where he used to point at a biscuit and he used to get it. Now, we are at a stage where we are making the things a bit tougher for him. So in the beginning, maybe for 4-5 weeks, you may feel him resisting certain things. Be patient. By that time, the herbs will also start working, and the child will start knowing that I have to use those words, and immediately the hyperactivity will start coming down. Be patient, don't lose hope. Do what has been guided to you. Results are definite to come, because with a 3.3 years age child, my target is not controlling the hyperactivity. My target is bringing those words for the child. If I start focusing on hyperactivity for an age of 3.3 years, that reflects learning age till 4 years of age, that will be lost. So, Braino A must be the one which we are giving to him. And yes, for a few days, you may experience a bit of him being a bit of more active, because below 4 years our treatment plans are different, and after 4 years our treatment plans are different. So don't worry. If you want, we can control hyperactivity at any stage, but that is not our treatment. Then there's only management. Our treatment is ensuring that he starts using words. That is the main priority at this stage. Srikanji, you have mentioned that sleep delay. I am taking him to speech and OT. Hitesh, try taking ABAs than OT and speech. My suggestion to you, that will be a better option. Don't use much of speech therapy. Don't use much of OT. Use more of ABA. So that's all for the day. We are having some further questions coming our way, but for those of you who joined us a bit late, sincere apologies that I may not be able to take your questions as of now. Rizwana ji, a very warm welcome to you. But then, since we are running out of time, I may not be able to take your question. But since you are over there with us, please share the videos, some details further in regards of your child, and be rest assured I'll be guiding my team in regards of everything that is good for your child. So, with the words that all of you may stay wrist pushed, healthy, with the help of Ayurveda, I, Dr. Navdeep Sharma, shall now be taking a break from you. Have a good day.
Empowering lives. Group activities for autism at Care Nirogam Private Limited.
A very marked problem which is being faced by majority of autistic kids is socialization. The children, they do not perform up to the expectations of their parents, the society, when it comes on the part of social interaction with other children. And that is why, keeping this in mind, we at our Wrist Pushed Center Chandigarh go for various social activities.
Inspired by the rich culture of Amritsar, we are rooted in tradition and diversity. Drawing energy from the vibrant city of Chandigarh, we embrace progress and inclusivity at Care Nirogam. Why stay at Care Nirogam for best results in autism? Ayurveda, Panchakarma, psychotherapy, ABA, OT and speech therapy, yoga and naturopathy, group activities, outdoor activities, all under one roof. Welcome to Care Nirogam, where we believe in creating a supportive community for individuals with autism. Today, we are excited to share how our carefully crafted group activities are making a positive impact on the lives of those we serve. At Care Nirogam, our team is dedicated to designing activities that cater to the unique needs of individuals on the autism spectrum. Our group activities are more than just fun. They are therapeutic and designed to foster social skills, sensory integration, and overall well-being. Our therapies provide a non-verbal way for individuals with autism to communicate and express themselves. It's amazing to see the creativity that unfolds during these sessions. Exercise is not only beneficial for physical health, but also for emotional well-being. Our group exercise sessions focus on building strength, coordination, and social skills.
Specialized Panchkarma therapies at Wrist Pushed.
बाद बच्चे में काफ़ी इम्प्रूवमेंट है उसमें आई कांटेक्ट आ गया है, अंडरस्टैंडिंग आ गई है।
फर्स्ट पंचकर्मा से ही दिखने लग गया था कि गोकुल में थोड़ा थोड़ा स्टेबिलिटी आ रही है, एक आधे वर्ड्स भी बोलना शुरू कर दिया था।
5वें में बहुत सारी इम्प्रूवमेंट आई है, उसमें इमोशंस आ गए हैं, वो कुछ बातें अंडरस्टैंड भी करने लगी है।
मेरे बेटे की अंडरस्टैंडिंग में बहुत इम्प्रूवमेंट आई है।
You can see our therapists really improved the understanding of autistic kids.
पहले शुरू में मेरा बच्चा चीखते थे, हर टाइम अचानक चीखते थे, हर टाइम चिड़चिड़ापन रहते थे, हाइपर था, बहुत ही हाइपर था। मेडिसिन लेने के बाद उसका ये चिड़चिड़ापन, एग्रेशन बहुत ही कम गया है। मेडिसिन के साथ साथ पंचकर्मा भी दिया है और साथ साथ में साइकोथेरापी भी चल रहे थे। तो ये साइकोथेरापी, पंचकर्मा और मेडिसिन लाके कुल मिला के मेरा बच्चा अभी बहुत ही बेटर है।
You can see our therapist really improved the hyperactivity of autism kids.
The Panchkarma therapy here, which has Shirodhara and Nasya in it, and it is really recommended, very relaxing, and everybody and whosoever needs it must go through it.
हम लोग अपने बेटे के लिए आए हुए हैं यहाँ पे, आयुष्मान मंडल, जिसका उम्र लगभग 14 साल है। यहाँ हम लोग पंचकर्मा थेरेपी लिए। यहाँ का माहौल इतना फ्रेंडली, डॉक्टर, स्टाफ सारे कुछ बहुत अच्छे लगे।
पहले ये ना बोलती थी ना कुछ समझती थी, लेकिन जब से ट्रीटमेंट ले रहे हैं काफ़ी हद तक इसमें इम्प्रूवमेंट आई है।
I came in contact with Dr. Navdeep Sharma regarding my son Shitek. So he is 3-year-old and he is having speech delay and he is having some ADHD behavior. It was a good experience. But one thing I can say for sure that my son's sleep routine is pretty much better than before.
We came to this center, had an appointment with the doctor. We had a great session with him. He has immense knowledge about autism. He is specialized in autism and ayurvedic treatments. The therapies were done very well, and the housekeeping and everything was clean. The rooms are clean, so we had a good stay, good interaction with the doctors and therapists. So overall it was a good experience.
उसका पंचकर्मा हुआ तभी उसमें जो हाइपर एक्टिविटी था उसमें हमें बहुत फ़र्क नज़र आया, और उसकी स्पेशली जो स्लीपिंग साइकिल थी वो उसकी एकदम से सेट हो गई। जैसे वो रात में पहले हाइपर होके उठ जाता था, अभी वो भी उसका बंद हो गया, अभी उसको स्ट्रेट स्लीप मिलती है।
तो हमारे बच्चे की बहुत अच्छी इम्प्रूवमेंट है। पहले तो हमारा बच्चा बात भी नहीं करता था, लेकिन कोई समझता नहीं था, अब इसमें स्पीच भी आई है, अंडरस्टैंडिंग आई है।
At NDK Nirugam, we are committed to creating a supportive and inclusive space for individuals with autism. Our group activities are designed to empower and enrich lives, promoting social connections and overall well-being.
Now, these activities are one of the most important part of the treatment. Once we talk about a perfect social interaction that can only happen when social activities are being planned.
If you are looking for a place where your loved ones can thrive, come join us at NDK Nirugam. Together, let's empower lives and build a brighter future.
Helps thousands of children around the world to recover successfully. He believes in the holistic healing power of Ayurveda, addressing the root cause of autism rather than just treating the symptoms. Dr. Sharma combines traditional Ayurvedic practices with modern research and technology to deliver effective and sustainable results. His commitment to excellence and patient care has earned him accolades and recognition within the Ayurvedic community. Dr. Navdeep Sharma, renowned Ayurvedic doctor, gains media acclaim for expertise and contributions. Call now to connect with world's senior most Ayurvedic doctor.